One.
All right, good afternoon, everybody. It's our daily briefing on the COVID-19 response. I'm here with Josh Jabal, and I'm here with Barbara Cass. Barbara is an expert on nursing homes, dealing with all of our negotiations with folks there, member of our Department of Public Health, to better answer any questions regarding the nursing homes. And Kurt Westby, our amazing Commissioner of the Department of Labor, will be on board as well to tell you a little bit more about how we're processing the unemployment claims. I'd say his news will be better than what you see here in the daily summary. It's not that the numbers aren't surprising. You know, the number of hospitalizations is pretty much what we've been describing for the last week or so, which is that it's not going up exponentially. It's going up in a linear way, consistently going up, but not exponentially. And that means our hospitals have time to prepare and maintain their capacity, which they're doing. Nobody is being denied. What I meant by that is you'll see that two charts are not filled out. That's for positive cases and tests performed. We're still waiting to get that data back from our out-of-state labs, and Josh assures me we ought to have all that information available to you, by the end of today. We have had some technical issues. Maybe some of you heard we were on CTN earlier, briefly, for our bond commission meeting. That was interrupted by some audio issues, which will be, we'll get that meeting going again next Thursday. But the bond commission meeting just reminded me that in the middle of this COVID crisis, our government continues to move forward. And whether it's foster kids over DCF and our need to take care of them, whether it's people with disabilities, physical, intellectual disabilities, our constant obligation to take care of them, and proud to do it. Barbara will tell you about our folks in the nursing homes, and they've really stepped forward, by the way, as we find additional capacity and space for folks in nursing homes. 39% of our nursing homes now have somebody who's been infected. We have space to quarantine people within nursing homes, new nursing homes. I'm told to give a special shout out to Waveney and Athena, two of our nursing home providers that have made additional space available now, and really to all the folks in the nursing home community and all of you working in those nursing homes, thank you. Thank you for what you're doing. I can just turn the page a little bit again on hospitalizations. What you ought to see is probably the bottom graph there. Again, you see that the line is fairly consistent in terms of the number of new hospitalizations, again, which means we've planned accordingly and we have still some capacity. The next chart will show you a hospitalization by county. I don't see anything that is out of ordinary from what we said before. You see 52 new hospitalizations in Fairfield, 38 in New Haven, 8 in Hartford. As Dr. Carter has said a little bit, I think social distancing is working. You see that not only in terms of the number of hospitalizations flattening out a little bit, but also the growth from Fairfield to New Haven to Hartford and then east and west is perhaps not going as fast as we had modeled at one point, maybe a few weeks ago, a couple weeks ago. And again, I think that's reflective of the importance of social distancing and what a difference you're making. I would like to describe something else to you. It's on the next chart, and these are COVID cases by ethnicity. And this is really important as we try and target our response and make sure that what we're doing is keeping all of our folks safe. And you'll see here on the chart, it's interesting, first off, in terms of who has been infected by ethnic group. You'll see Hispanics, probably 175 out of 100,000. Whites, more like 100,000. African-American folks here in Connecticut, 200,000, so maybe twice as likely to be infected per person, and Asians, maybe 50. And this is important because I really would want to talk about our underserved communities and what we're doing. And first of all, this is not simply a matter of testing. You may say, maybe it'd be even worse if we tested more in Black and Hispanic communities. We're making a very important effort to make sure that people get tested fairly and aggressively on as fair a way as we can. I mentioned to you yesterday talking to the CEO of CVS, the major drugstore company that's part of Aetna family, and they have now committed to setting up 2 important Abbott Lab 15-minute tests, one in Stamford and one in New Haven. We're going to get that going, I hope, within the next week, 10 days, to make sure that people are tested and know where they stand on a broad-based basis, regardless of whatever community you may be or a part of. Other reasons, I think, about why you see a higher proclivity for people who are infected by ethnic group, by ethnic communities, and you'll see, sadly, also by fatalities, is just different characteristics. Folks in these underserved communities are less likely to be able to telecommute, more likely to be forward-facing, dealing with folks every day, more likely perhaps to be nurses, more likely to be daycare providers, more likely to be a grocery store, folks. They're on our front lines, but it does put them at a little more risk if we don't take care of them every day with the necessary PPE that they need. They're more likely to live in an urban environment. That's what I mentioned when I was talking about getting the testing in Stamford and New Haven, ASAP, pronto. And in urban communities, you'll see the COVID virus spread a little more quickly. We certainly saw that down in New Orleans, for example. And it's just less easy to social distance. And by the way, that's why these numbers broken down by state are not as meaningful. You ought to be really looking at the different hot spots, and you'll find congested areas are a lot more susceptible to the spread. Again, that tends to impact our underserved communities. Many of the folks have bigger families and living in smaller apartments. So it's tougher just to social distance within your own apartment, your own residential dwelling. We are working on that by making sure that we provide additional hotel space or other space for folks in that situation. They have a loved one at home who is either infected or has been exposed to someone who is infected, contact. We're finding them space, so they don't actually have to be at their residence. We can find them another place that they can go to make sure that they're safe and to make sure that their families are safe. Finally, the folks in the Black and Hispanic communities are much more likely, I'm afraid to say, to have pre-existing conditions. An African American is probably 4 times more likely to contract asthma or diabetes than their white or counterpart, and similar numbers for Hispanic. And that's why you see the higher infection, and I'm afraid you'll see on the next chart some of the differences when it comes to death by ethnicity, and certainly the Black community has a higher ratio there. Hispanic community a little less, which is sort of interesting when it comes to pre-existing conditions. All right, what can we do about that? We can do a lot about that. Deirdre Gifford, our amazing commissioner over at DSS, the Department of Social Services, doing everything we can to make sure that we can expand health care coverage for all of our people, especially folks now in the underserved communities. Medicaid is expanded by about 14,000 people over the last 2 months. There's now a 90-day grace period. We provided a 90-day grace period for folks in health insurance to make sure their health insurance cannot be cut off, in the middle of this pandemic. And it's the same thing for Medicaid beneficiaries. You have a 90-day grace period there. And the other good thing is we're expanding access to Medicaid and expanding access to primary care physicians. And what that means in terms of your ability to get a test if you're not feeling right is conditioned upon expansion of Medicaid and expansion of access to a primary care physician. We have about 100,000 people now on SNAP, which was formerly known as food stamps. And not only that, but Deirdre is also raising the cap on your SNAP benefit a little bit to compensate for the fact that fewer people are working. We want to make sure they have more access to food. Your card, your debit card will automatically see that over the next couple of weeks. I can tell you we're thinking long and hard about the business loans. You know, the bridge loans that we provided, and we've worked hard to make sure that women and minority-owned companies know where they have access to these bridge loans so they can keep their companies going forward. About 20% of the companies that applied for our Connecticut-based bridge loans were women and minority-owned companies, a little better than their proportion within the entire state. We've also been working with HEDCO, which is the Hartford Economic Development Corporation, and have a special program for women and minority-owned companies. You have less than 10 employees. Is that what it is? Less than 20 employees, 0% interest, forgivable loan, targeted on helping you keep your company going, keep your company intact, so on the backside of this pandemic, you're able to go. And those will be forgivable loans up to $20,000, targeted again on this underserved community. I'd like to really thank Senators Fonfara and McCrory for helping to take the lead on this and remind us the importance to make sure that our economic aid to our small business include all of our small businesses. I'm thinking a lot about the $1,200 per person grant, $2,400 per couple, plus $500 per child coming from the federal government as soon as next week. And remembering right now, that is conditioned upon you having paid income tax over the last year or two. And then we're also reminded that a significant proportion of our residents don't file income tax because they're not obligated to file an income tax. So I want you to go to the IRS website or to 211.org, and we'll show you how to file your claim to make sure you have access to that same $1,200 grant that helps you pay for those necessities, right now. Those checks will be coming out very, very soon. As you know, we've coming out with an executive order within 24 hours that means that no landlord will be able to initiate evictions for each and every one of you in a rental unit, over the course of at least the next 90 to 120 days. What we've done in terms of mortgages, and we have a grace period there. We're providing similar support for people who are renting, make sure that they can rest easy. You know as well that the power company and water company have a grace period in terms of not cutting off any service. That's same for the cable TV companies as well. So you ought to have some confidence that things will hold steady as we get through this pandemic going forward. I should tell you that Kurt Westby will give you a little more detail on our unemployment claims. Those checks are already starting to go out. We're working on a technical fix for the unemployment claims, and I know Kurt will be happy to give you a little more information on that as well. You know, with that, maybe I just ask Barbara to say a few things, if you would, about where we are on nursing homes right now and how we can give people some confidence that their loved ones in a nursing home are being taken care of as safely as we can.
Thank you, Governor. So the department looked at what was happening and how we were addressing the COVID response, and we knew that we needed to look at nursing homes as we developed our medical surge plan. We knew that nursing homes would be an integral part of the plan, and we also knew that there were some challenges with accepting individuals who were hospitalized with COVID-19 into the nursing homes. So I'm here to tell you that nursing homes, the existing nursing homes that we have in Connecticut, are capable. They stand ready to care for your individuals and your loved ones in the nursing homes. But one of the things that they will be looking for, and we have the capacity to do it, is provide 2 negative tests for hospitalized individuals. And once those 2 negative tests are identified, the patient will be transferred to the nursing home. We have approximately 2,000 empty nursing home beds in the state. We are working with nursing homes to help them understand what they need to do to care for your loved ones. We are working with them on enhanced infection control strategies and on what staffing requirements are needed. We also have looked at other options in caring for individuals who are COVID positive. So we've looked at 2 different concepts. We've developed COVID recovery facilities, and in this concept are 2 nursing homes that will be converted to the care of individuals who are COVID positive. And then we've looked at alternate care sites, which have been previously vacated nursing homes or alternate spaces that have been made available to healthcare facilities to expand to this level of care. So individuals who are in the hospital who previously lived in a nursing home might likely go to one of the converted nursing homes. And then individuals who are living in the community or in congregate settings, and once they recover to the point that they can be cared for in a nursing home, they would go to one of the alternate care sites. And as they progressed and they convalesced and they improved, that particular nursing home would help assist them with community and discharge planning. So we work every day with nursing homes that do have cases of COVID-19 in them. I want to assure you that the department is working very closely on staffing, looking at infection control standards. We're looking at their availability for PPE, and we stand ready to assist them as needed.
Hey, thank you, Barbara. And Kurt, do you want to say just a few more things on unemployment comp?
I'd love to. Do you hear me?
Yes, sir.
We understand it's a financial crisis when any individual is laid off, and we at DOL are doing everything in our power to manage this tsunami of claims that have been submitted. So please be patient as we get to your claims. Once processed, they will include retroactive payments. We already doubled in 1 week the number of UI payments going out. Let me put these burgeoning numbers in perspective. Since March 13th, there have been 302,000 claims submitted. Now that is 2 years of normal claim activity in just 1 month. Of those 302,000, we've managed to process 132,000. Yet there remains 170,000 outstanding that we're getting at as fast as we can, all using our 40-year-old COBOL computer system. So what else are we doing about it? We've quadrupled staff. We're working overtime. We're working weekends. As a result of that, we've processed 10 times the normal weekly load that our processors would normally process. And all of this while staff are enduring the same COVID threats as everyone else. That's still not enough. We introduced a technical fix number one, where we emailed applicants who had already submitted their claims to resubmit their claims through what we have in our system as a temporary shutdown file, which is completely automated. That yielded another 40,000 more processed claims, but that still was not enough. So we're working on another technical fix, Plan B we call it, which will basically force claims into the automated process. And we're testing that right now, and we hope to have seriously reduce the backlog with this intervention. Timeline on this is hopefully days, and if that works, we'll be able to convert a huge amount of those claims relatively quickly, over 2 or 3 days. So in the meantime, for new filers, if you're filing now or in the future, please go to filectui.com. There's a link above the blue button for instructions and a tutorial that we worked out that reads, for quicker payment of UI benefits, please follow these instructions. If you do that, you'll end up in our automated system and you won't have to wait very long. If you've already filed, check your emails daily for updated messages and follow them. Again, we are getting your claims out and processing them as quickly as possible. And with our next technical fix, we expect to drastically reduce the backlog. Please bear with us. Thank you.
Thanks, Kurt. Any questions, Max?
Yes, we're going to open up the questions. We'll first go to WTIC 1080 radio. Dave, go right ahead. Unmute and ask your question.
Hi, Mr. Governor. Schools at this point are still open till April 20th, but most people are expecting, and you've suggested it could be the rest of the school year. When will that decision be made, and are we getting closer to that?
We're going to make that decision within a week. Obviously, I'd love to open up those schools at some point in June if I could, if I thought I could do it safely. Right now, I'm not sure I can do that safely. We're going to give people guidance within the next week.
Next question will be Christine Stewart, CT News Junkie.
Hey, Governor, thanks for taking our questions. So the governor of California has struck a deal for 200 million masks, 150 million N95 and 50 million surgical masks per month. Does this mean that the state of Connecticut somehow missed out? And what are we doing regarding the 6-state consortium on purchasing?
Well, I'll start out and then hand it over to Josh, but we're working on significant purchases of PPE. We're working with our fellow governors around the region as well. Right now, we have capacity in PPE to take care of most of our frontline responders. We're going to do better on that, and I hope to be able to have some good news for you within a few days. Josh?
Yeah, and in fact, the good news is starting to arrive. We received a significant shipment of masks today that are going to be distributed. But I think, Christine, some of those numbers you cited, if you were to adjust those to Connecticut kind of population size relative to California, we have very significant orders placed. Some of our original kind of longtime suppliers for this type of equipment have had their supply chains severely disrupted. So we've had to be much more creative in our procurement strategies, but we've been successful in that regard. And I think in the coming days and weeks, we're going to see a significant influx of PPE into the state of Connecticut that will alleviate the challenges we've been facing over the last couple of weeks.
We'll go next to Channel 3 Eyewitness News, Matt Campbell.
Yes, this question is for Mr. Westby. You talk about quadrupling the staff at the Department of Labor working on these unemployment claims. what's the number of workers that you have on this right now? And I think a lot of people just want to know when they can expect their checks. Is there a time frame for that?
Yes, the number of people we have working on claims right now is 80 plus. It was only 20 just a few weeks ago. So that number 80 plus is 4 times the number that we've had before, and it's growing. As far as the actual wait, we're seeing a 5 to 6 week wait for people who file now, as long as they're not using the automated system. If they use the automated system, the wait won't be anywhere near as long as that.
And Governor, do we have any stats on the recoveries right now?
We're going to have those stats by the end of today, and I'm going to go over those tomorrow. Right now, what you see on hospitalizations is the net number between people being admitted and people being discharged. But I'll be able to give you better information on who's being discharged and the rate of success we have there tomorrow.
We'll go next to Hartford Current, Chris Keating.
Yes, I'd like to address this to Barbara Cass. Can you tell us, are there more possible deaths at the Milford nursing home that have not been labeled COVID deaths? Also, can you confirm the number of 4 cases at that home that we've repeatedly heard about?
So we are watching that nursing home that you have indicated. We actually have conducted an on-site inspection at that nursing home and have been in touch with the nursing home every single day. We're verifying staffing, we're verifying adequate supplies of PPE, and we're monitoring the situation closely. I'm unable to verify the number of deaths. I don't have the documents in front of me, but we can certainly get back to someone on that.
And can you also tell me more broadly, what is the status of moving people out into the specialized COVID homes, for lack of a better term?
That process has not actively started. The nursing homes are notifying family members, they're working with residents, and we anticipate that that will be happening shortly.
We'll move on next to Sue Haig of the Associated Press.
Good afternoon. Governor, you just said that most of the frontline workers have the gear they need. I was on yet another conference call where there were, this time, nursing home workers who were talking about using trash bags for protective devices, for protective gear. They're petrified, and they say they're scared actually to work in these COVID-only homes. They don't think that the state is going to provide enough care, and because they're not getting what they need now. So how can, I guess what's happening with that gear? Because they're just not getting it as far as we're here.
We're going to get that gear out to people as fast as we humanly can. As you heard Josh say, we've got a good backlog. We got it on order. It was scheduled for last week, scheduled for today, scheduled for tomorrow. And those frontline workers are our number one priority. God bless you. In the meantime, if you have to wear a mask, you make yourself do that. But most of our people have the PPE, and those that are not getting it right now are going to have it within a few days. That's my hope.
Is it going to nursing homes specifically?
Yeah.
You want to talk about that, Barbara?
Yes, thank you. So we are monitoring PPE supplies very closely. Every day at 8 o'clock in the morning, the long-term care mutual aid plan is activated, and messaging goes out to every single nursing home in Connecticut. And by 10:30, 11 o'clock, we have a good landscape of what's happening across the state. Facilities at that point can report any issues they may have with their PPE supplies, and if they are experiencing any shortages, we are responding to those. So we have also had other conversations today to reach frontline workers so we can see what's happening to the boots on the ground people. We have opened up messaging systems so that we can hear from them and hear anecdotally what may be happening that may not be reported by nursing homes. So we're actively pursuing other opportunities to get a better understanding of where the PPE supplies are. But when we do go out on site, and I want to assure you our surveyors are on site, we're verifying that there are adequate supplies of PPE in place. That's a very important issue for us to follow up on. Thank you.
And I'm sorry to monopolize this, but when you're talking about adequate supplies, what does that mean? These people are talking about having one mask that's not necessarily the really good ones that everybody wants, but they have to have it for like days and days and days, and they're all kind of old and they're not working anymore. I mean, what do you consider adequate supplies?
So, so adequate supplies can vary from facility to facility. So to your point, we have to risk adjust what adequate supplies are. So if there are 20 individuals who have been infected with the virus, certainly the PPE supplies are very different than a facility that doesn't have any infections that they're reporting. We are referring back to the CDC guidelines for PPE and PPE conservation strategies. We are working with nursing homes very closely. We're doing frequent communicating with them. Our healthcare associated infections program and the facility licensing and investigations program are on the phone frequently throughout the day with many, many nursing homes to assist them and guide them so that they understand what the guidelines are and what measures they can take to conserve PPE.
We'll move on next to John Craven, News 12 Connecticut.
Hi there, Barbara. I'd like to actually follow up on Chris's questions about Golden Hill in Milford. I know you said you don't have an updated number of deaths there, but the last update we got on COVID cases at that facility was Friday, which was 44. I mean, can you give us an updated number, or at least tell us, has that number gone up since Friday?
I think the number is 44. That's what I recall from yesterday, but I'm reluctant to confirm that number, not having the documents in front of me.
And just to follow up, is there any plans to release a total number of COVID cases at these facilities? Because we keep hearing from families who are said, okay, that's great that we have a list of places that have coronavirus cases, but one case is a lot different than 30 or 40 cases, and the families feel like they have a right to see how many are at each facility.
Yes, so we are releasing the numbers associated with each nursing home weekly. We anticipate that a report will be going out very soon. We are looking at those numbers and certainly giving the nursing homes that may have 25 cases, they're being reviewed. Consultation is being done with them frequently throughout the day. So I want to assure you that they're getting extra attention and extra monitoring.
And sorry, just one last question, Barbara. Golden Hill, is that being considered as one of the facilities that would be COVID only or not?
No, that's not a facility that's been dedicated to being a COVID recovery facility.
We'll move on next to Bob Wilson, News 8.
For Barbara Cass, describe what it's going to look like for people who have loved ones in the nursing homes as they're moving people around. I picture there's going to be ambulances. How bad a shape are they in? Are they going to go to hospitals first? Kind of paint a picture so that as you start moving them in the next day or two, or as you say soon, what is it going to look like?
And are you referring to the facilities that we're converting to COVID recovery facilities?
Correct. Recovery, or
okay.
My mom is in a nursing home right now. She has COVID. You're moving her. How are you going to move her, and what strategies are you put into an ambulance, or?
So it'll be a very thoughtful strategy. It will be a strategy that includes residents, family members. We're working with the Long-Term Care Ombudsman program, and I know she is doing lots of FaceTime chatting with family members. We anticipate that it will be done with ambulances or transportation vehicles that the facility may have. So because we are asking and expecting it to be a thoughtful process, we expect it will take a couple of days. For the alternate COVID conversion facilities or recovery facilities, we would expect the admissions from the hospital to be like any other hospital to nursing home admission. So it would likely be an ambulance transportation from the hospital to the nursing home.
Move on next to.
Thank you, which brings up, well, I have one other follow-up to that. Respiratory therapy, when you go on a ventilator, you have some pretty severe damage could be done to the lungs. Is there enough for them to recover with? Is there enough equipment for long-term care of people who come off of ventilators?
We are not expecting or anticipating that anyone who requires a ventilator will be cared for in one of our COVID recovery facilities. That's dedicated to the hospital level of care. We are looking at the number of ventilators we have. We're looking at those numbers every day. There are some reallocations that have been happening across the state when there are needs that are perhaps not, I don't want to use the word unmet, but we want to anticipate and prepare. So there have been some movement of ventilators across the state, but we do not expect or anticipate, and I do want to underscore, do not expect any of the COVID recovery facilities to be operating with ventilators.
I'll just add, right now, we still have enough ventilators. We've allocated them appropriately. We have extra capacity in Fairfield County, as well as the rest of the state. We're monitoring very carefully. Josh knows where every ventilator is in the state, so we can make sure it go to a place of need. But nobody's being denied for lack of a ventilator.
We'll move on next to Jenna Carlesso of the Connecticut Mirror.
Hi, my question is for Barbara Cass. Could you talk about the two facilities you are eyeing for COVID positive nursing home residents? And also, would they be primarily for folks who are being discharged to a hospital who would otherwise go to a nursing home, but instead they're going to those buildings? Or will people also be moved out of existing nursing homes to those buildings?
So we have two concepts. One of them, and as we looked at surge and tried to build capacity, we have two different pathways. First, I do want to assure you that nursing homes do have the capability in most cases and the capacity to care for someone who is COVID-19 positive. However, as we moved forward with our planning, we identified that we needed to build capacity in the nursing home system. So we have converted 2 nursing homes to COVID, and I have to keep catching myself because this was a new term that we developed yesterday, a COVID recovery facility. So 2 concepts. One is the conversion of 2 nursing homes that are going to be dedicated to COVID positive patients. And then the other concept of COVID recovery facilities were vacant spaces or perhaps previously vacated nursing homes. So we have one entity, and as the governor had mentioned, Athena has provided a vacant nursing home, converted it to a nursing home that, again, they will be caring for individuals and dedicated to COVID-19. We have a facility in Fairfield County that will be standing up a COVID dedicated unit in a campus of a hospital. So that will provide 60 beds additional capacity. So the Athena building will provide 126 extra beds. The Fairfield County will provide 60 extra beds. The converted nursing homes will provide 88 beds in one facility and 146 in the other. So as we continue to look at surge planning, we continue to look at surge capacity as well.
Could you tell us where the 2 nursing homes that are being converted are located and what they're called?
Sure. We have the converted nursing home in Fairfield County, which is an Athena home, and then we have a converted nursing home in Sharon. And then the alternate care sites are in Torrington and in New Canaan. And we are moving forward with looking at other capacity as well. Alternate care sites may come online.
We'll move along to Paul Hughes of the Republican American.
Thanks. I've got 2 questions, one on testing and one on the unemployment insurance fund. The Connecticut Business and Industry Association is saying that employers can expect an increase in unemployment taxes and perhaps an additional assessment to pay off any federal loans regarding, handling the increase in unemployment claims. What sort of costs are we looking here? What can employers expect to see in terms of additional costs?
Kurt Westby here. Well, what we're doing to mitigate or actually put off those costs is looking at freezing the experience rating this year for the duration of the crisis, so that there in fact will not be an increase for the duration anyway. So we're hoping to put that into effect, and we're in deliberations with the administration on pushing that through.
What about an additional assessment for any federal loans?
Well, normally when there are federal loans, and there will be federal loans, we'll be applying for federal loans fairly soon because of the huge uptick in the number of claims. We can ask the federal government for that. And we will be asking them for loans. We have also asked them if they would be willing to convert those loans into grants. If they were grants, then there would be much less of a threat of raising the experience rating on the employers. They have not replied in the affirmative yet. They haven't replied at all. They're looking at it. So at this point, it's too hard to say exactly what the increases might be, because we still don't know where the trajectory is going to end, but we're trying our best to mitigate where we can any increases at all.
Okay, thank you. And on testing, the Republican Americans receiving multiple reports of people trying to get tested at our hospitals, but to no avail. The hospitals say they test as many people per day as they have kits available, but the demand for tests far exceeds the supply, so people are getting turned away every day, even people who are sick. So what's being done regarding this? Is, where do the test kits come from? Who's the
Can you tell us, without naming specific businesses, what industry